there's usually a protocol. Each center probably has their own protocol, but you know, leading up to surgery and even afterwards, there's often a liquid diet that is prescribed, usually a high protein diet because we know protein helps with wound healing and recovery. Post-surgical, it also helps in regulating appetite and helping people manage their nutrition post-surgically. So that's something that I would expect. I would expect not to be super active, right afterwards, just like with any other surgery. Um, but the turnaround time is really fast now. You know, I don't want you to feel terrible about yourself, and I'm sorry that you do. And I'm suspecting that you feel bad because maybe you didn't have the result you were expecting with the sleep. You shouldn't blame yourself because there is so much going on. One of the things that I think is a real tragedy is the fact that we developed bariatric surgery and made it much more accessible than obesity programs. Way before obesity programs became a thing, which they're still just now becoming a thing. Like my obesity practice, I just started in the past year and was the only and is the only obesity practice at the largest healthcare provider on the West Coast. And they didn't have one before me. So like it's crazy that one of the biggest healthcare systems in the US, one of the biggest hospital in Los Angeles did not have a weight loss program. Didn't have one. And I started it there. So you can see that the problem is we came up with these surgical programs to help people manage their disease, but we had no intention on how do we manage these people long term. So they'd come in, they'd give you a lot of education because insurance said you got to do 3 months of training, working with a dietitian, psychologist, behavioral specialist, blah, blah, blah. And then people had surgery and then they kind of they let you go. Maybe they'd see you every 6 months or a year, do some checkup, do some labs, make sure your vitamins were okay, but you wouldn't get ongoing support. And that's a problem. Why is it a problem? Because bariatric surgery is not a cure for obesity, guys. Obesity is a chronic and relapsing condition. That's why people yo-yo, and that's why people often have progressive weight gain throughout their life. It will continue to get worse unless we address it and address it using evidence and science-based interventions. People need ongoing support to help them manage their disease because it's incredibly hard to treat. I don't need to tell you that. You guys live it, right? I don't need to tell you how hard it is to manage your weight with all of the considerations in the world we live in the with the advertising and then the food, the hyper palatable food, with the stressors in our life, with the increasing ability to live our lives without moving. Like I was just talking to a patient this past week. I was like, you can build an entire company out of your garage or your bedroom now. You don't even ever have to leave. We've never been more sedentary in our lives than we are currently. Like I can have Postmates, Amazon, everything delivered to me. I never have to leave my house. We're more sedentary. We eat more than we ever did. And a lot of that has to do with the way our society is structured and what is valued as important. And so in a lot of ways, our we're going against the default in order to try to be healthier. You know how hard that is? When everything is set up for us to not move and to consume, and we know that that's a problem for us, and we have to, and our biology is working against us on top of that. Like that's a lot. It's an uphill battle that people are having to fight, and you can begin to start to see and start to paint this really elegant picture that wow, this is really hard. This is why so many people struggle, why so many people continue to gain weight. Because you throw in life stressors, you throw in lack of sleep, depression, financial insecurity, housing instability, any number of things. And wow, it becomes overwhelming. People then are worried about other things. They're not even worried about their health or their weight. They're having to focus on everything else. And focusing and managing your weight, I've had patients tell me this, seems like a full-time job. I believe it. I 100% believe it from everything I see, from everyone I talk to. So yeah, it's hard. It's really hard to manage it. And that's why we need to have effective networks of support for patients. And the problem is our healthcare system still does an inadequate job to develop these systems. We don't have fully functioning clinics. We don't have fully functioning systems to support people in managing their weights. We're not addressing the big picture issues. We're not addressing the societal issues that make it easy to eat food and bad food. We're not addressing the societal issues that make it really hard to be active. We're not addressing the societal issues that you know refuse to acknowledge that weight is an issue and refuses to provide support and treatment and medications and all of these things. So it's really hard. Don't blame yourself if you're struggling. And if getting back to that question, if should you have surgery or not, that's really tough. That really depends on what you value. What are your personal health goals for yourself? A conversation with you and your surgeon on the appropriateness of converting your sleeve to a bypass. All of those things have to be taken into consideration. And it's not an easy decision. And so that's why you shouldn't make it alone. And you can't really, but you shouldn't make it alone. You should talk to a lot of people, be informed, do your own research, listen to really smart people like myself. I'm just kidding. But joking aside, but hopefully you can get some better insight. But understand, listen, guys, it's really hard, really, really, really freaking hard. So don't be a little. Have a little more compassion for yourself. It's not an easy thing to do, but the treatments are getting better. The public awareness is improving, and I promise you, the next 5 to 10 years, I'm really looking forward to. There is a momentum that is gathering in this space that we haven't seen previously. I can tell you, I'm working on a secret project that I can't talk about that I'm super, super excited. Hopefully, in the next 6 months, I'll be able to talk a lot more about it. That I think will be something that's really special and really help out a lot in this field. So there's a lot of really encouraging things, and we've talked about on my channel the number of treatments that are in development that are really exciting. So lot happening. I wish it would happen sooner, but the next 5 to 10 years are going to be special. And so I think we're going to make big strides for a lot of people. It's less likely. Less likely. It's based on the information we have available to us. People who have ongoing eating disorders may not adequately address those problems with surgery alone. Surgery is more effective at really addressing a lot of the biological appetite related issues and less effective at addressing the disordered and emotional eating issues. And so if that is a problem, patients can often have more weight regain after surgery if that issue is not addressed before surgery. And at least if the patient's not seeing improvement in dealing with their binge eating. I like, with many disordered eating issues, I like to take a multifactorial, multi-component approach. I like intensive behavioral counseling and training around it. I like the medication support because I think it can be really helpful to provide another tool for a patient who can oftentimes feel like they're a victim of sort of this compulsive and very impulsive condition that they're suffering from. So I find a lot of success with my patients when we take a multi-tool approach like that, both the therapy as well as the medication. They do pretty well. And that's a lot of what the literature supports as well. It's a very complex answer. It could be that your biological issues aren't adequately addressed by the surgery itself. It could be that there are other issues both externally and internally that need to be addressed that are drivers or promoting the ongoing struggle that you're experiencing. There's a lot. There's so much, and you really have to work with someone who is competent in being able to understand what are these contributors and who can help you assess areas that need to be addressed. Otherwise, it's going to be difficult. And I think continuing to take a blunt instrument, which surgery can sometimes be, to a problem that needs a scalpel, it can be an issue. And so I do want to say that should be appreciated. If there is a very specific issue that a patient is struggling with, whether it's disordered eating, whether it is an externality, it's not even something internal that they're struggling with, surgery is not going to fix that. And so we got to understand that those things have to be addressed. They need to be identified. And hopefully the bariatric surgery team or the support team around you have a person that has the ability or has the skill set to work with you on those. So the problem is there are not enough doctors and there are not enough healthcare professionals that do have that skill set. And really that is a lingering effect from this inadequacy of our system. And that's getting back to my original point about our system just not appreciating this as an issue, not appreciating obesity as a real problem, not appreciating the struggle of many Americans. And so I feel for you. I feel for you, and you are not unique in your frustration. Great question. Well, I think for starters, it starts with education, right? We all have to be playing with the same set of facts and understanding about obesity. And right now we're not. We are people with varying levels of information. Many within healthcare, including healthcare providers and physicians themselves, don't have enough education about this. And that starts in medical school, starts in within our system. I can tell you when I was in medical school, we the way we talked about obesity was a reflection of people just eating too much. I can tell you very bluntly, that's what they taught me. And I can tell you now, it's so much more and it's so complex. And we don't teach our physicians, our healthcare professionals about weights and the biological complexities, the social and psychological complexities. So I think it's really educating first. If we don't have education and we don't have knowledge of this, it's going to be really hard to understand and ultimately to have compassion. Because if you can't figure out where people are coming from or why they're motivated to say or do, or then it's going to be hard to bridge that gap.